Dr. Kevin Kavanagh. He is a retired physician and also founder of a national organization called Health Watch USA. Good morning, Doc.
Good morning, Jack.
How are you this morning, sir?
Very good.
Obviously, the story of the morning, and I know you're anticipating it, the FDA asking for states to pause on Johnson & Johnson out of an abundance of caution after 6 women developed blood clots. 6 women out of 6.9 million who got the J&J vaccine. My fear, and I want to know what you think about it, is that's going to give some fuel to the anti-vaxxers and may inhibit some people from going on and getting the vaccine. What do you think?
Well, definitely. I think it was the wrong decision. This is very similar to the situation that the Oxford AstraZeneca vaccine is in, and we talked about this with judging risks and what Europe did, and because of that, they have more now coronavirus cases and many more deaths than they would have if they just kept administering that vaccine. Both the Oxford AstraZeneca vaccine and our current Johnson & Johnson vaccine uses a capsule or a delivery mechanism for the contents which make that spike protein. That capsule is made from a virus. So it's different from the Pfizer and Moderna vaccines. But these type of complications are extremely rare. I'm not even sure you would even mention something that occurs in 1 in a million or less to a patient when you're counseling them. You would kind of group this into something of, and of course, rarely you can get severely sick or possibly even die, but it's extremely rare compared to the number of deaths we're still having from COVID-19. And I would expect that number is going to increase as we are getting these variants. Now, I should also add that when they talk about 6 people developing blood clots, they did not all succumb. Only 1 person died, and although that is very tragic, we don't want to have any deaths. Only 1 died, 1 was in the hospital, and the others were able to be treated, although they were quite serious. So I feel that, Jack, this was an extremely unwise move, and it's really going to set up President Biden for being blamed if there is another wave, both on promoting the anti-vaxxers and of not administering doses that could have been administered to prevent the viral infection. So for me, and I can just speak for myself, but I certainly would take the Johnson & Johnson vaccine, because remember, it was the one that was field tested in clinical trials with the South African variant, and it worked. It mitigated disease, it prevented hospitalizations and deaths. Although people still could get infected with the virus, they did not become severely sick. So that's a sign of hope, and now that's being put on hold. I don't think the governor had any other choice to do what he did when you have such a strong statement from the CDC and FDA. I think the decision rests firmly with the federal government, and for me, I think it was an error.
All right, this is one area where you've disagreed with Dr. Fauci. You haven't disagreed with him too many times along the route here. Were you surprised by the governor's comment that when we get to 2.5 million people vaccinated, we're going to lighten up and start opening up? Did that surprise you?
Well, it did a little bit. It does motivate people to get the vaccine, which I think was his intention. The big fly in the ointment and the big unknown is how well the vaccines are going to perform with the variants. And granted, we've talked about preventing severe disease and death, but the big question is, what will the recovery be like? Are we going to see this long hauler syndrome and post-vaccination COVIDs? All of this is really unknown. One of the things that really has irked me about our response is that we just focus on living. We're not focusing on whether or not people have long-term sequelae from this disease. I mean, life and surviving is a very low bar for existence. I mean, you need to have a quality of life, and many people with long COVID have not reached that yet. So this is a dangerous virus. We need to respect it. And right now, we are falling behind other countries, what they are doing to confront this pandemic. England, they're gearing up to test everybody in their population twice a week. And we're still arguing about whether or not we should do testing in schools. So, Jack, I think that we're falling behind in taking this virus seriously, especially with these new variants which are on the horizon.
Dr. Kevin Kavanagh, always a pleasure, sir. We'll talk to you on Friday.
Thank you very much, sir.